Medics, what is a sign a patient has used drugs heavily in the past? When you give them 6 milligrams of Versed and 300 mcg of fentanyl, and they are still talking to you like normal. I've had to cancel a procedure because of this. Got to 5 and 400, and they were still wide awake and could feel everything. Nursing and myself were uncomfortable at those doses and had them reschedule with anesthesia. He can hit his veins better than you. I was an Army medic, and when I offer to hit my own veins, I always have to follow up with that. I don't look a drug user, but sometimes you can be surprised. It's damn hard to get an IV in them in our usual go-to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. I lived with a med student who came home one day and told us about the necrotic penis she'd seen that morning from a user who had collapsed every vein he could find and had resorted to the last one. Talc retinopathy. Tiny talc particles accumulate in the retinal blood vessels of IV drug users and can be seen during a routine eye exam. Absence of talc retinopathy is certainly not a reliable way to rule out IV drug use in a patient because it is a relatively rare occurrence even in heavy users. I myself have only seen it once in person, although I do not work with a heavily at-risk population. From what I've read, talc particles are capable of bypassing capillary bed infiltration and entering circulation, so a micron filter would only help if it could filter out incredibly small particles. The main concerns with talc retinopathy involve restricted retinal oxygen and retinal blood vessel compromise. This can result in hemorrhages, ischemia, lack of tissue perfusion, and neovascularization, new blood vessel growth. The latter of which is characterized as a proliferative retinopathy and can result in blindness from a tractional retinal detachment. They look 10-20 years older than their stated age. This one is so true. Took care of a very sick pancreatitis patient in the ICU over the weekend. Dude was in his late 30s and could easily pass for late 50s. 60-year-old man who had done some drugs in life but was a heavy alcoholic. Never tells doctors of his past. Quit all by age 50. Health is falling apart by age 60. Doctor does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Doctor shows him the extra space in his skull around his brain, explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. After a blood draw, I was asked if I was a heavy drinker. I absolutely was, but had my shit wired pretty tight at the time, so I asked how they knew. Guy looked me dead in the eyes and says, "Your red blood cells are the size of damn dinner plates." I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. Man, getting that dye injection. I remember the nurse telling me it was going to feel like I'm peeing, but I'm not. I remember going, okay, yeah, I won't think I'm peeing. That dye went in and immediately I was like, oh gosh, shoot, I'm taking a, wait a minute. Big ass hole in the nasal septum with no other explanation for cause. Work in anesthesia, they require 5x the meds to go sleep. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July, admitted to coming down after smoking meth. I remember doing phlebotomy rotations at a hospital in the middle of nowhere, Tennessee. Aside from the small 60-bed hospital, there was nothing but farmland for miles. I met a patient with heavily scarred, twisted veins. I failed to hit a couple times, but eventually found a viable one. IV users can be tough sticks, but what makes me remember him to this day is the forlorn look in his eyes when he softly asked me to be careful because it was his last good one, so please don't blow it. I did residency in Phoenix, Arizona. One of our nurses frequently referred to the tooth-to-tattoo ratio as a predictor of the amount of methamphetamine use. There was a consistent inverse ratio. If they are in recovery, they will often use a lot of sugar and caffeine. If currently using, they'll spend a lot of time in the bathroom. When you tell patient, doctor ordered morphine, and they tell you only Dilaudid works. Addiction knows no bounds. I work as an addiction counselor in medication-assisted treatment, methadone, Suboxone, and my clients range from homeless, barely 8th grade educated people to former doctors. That said, addicts are highly impulsive, manipulative, and typically aren't the most forward-thinking people due to the nature of addiction. It's usually in their charts, but if it's not, hepatitis C, liver failure, pancreatitis, and overall health status and appearance for their age is usually a good giveaway. 10 out of 10 pain score every time you ask. Some erratic behavior is common too. I see a lot of CKD in diabetes and chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke, and alcohol abuse. I've rarely ever had a meth addict and rarely crack users, so this applies mainly to those drugs. When they are 25, 30 years old and look 50, you can tell by the way that they are. The surprising ones are the closeted grandma/grandpas. I worked in the cath lab and an older lady's cath was negative and the doctor told her, "Then what caused me to have chest pain?" "Probably your habit, ma'am." "What do you mean?" "The heroin." "Oh, really?" She looked like your average quilting champion. The obvious signs are obvious. The less obvious but more insidious signs is a history of emotional or sexual trauma. Don't judge. Substance abuse treatment nurse here. There are the obvious signs to when someone has or is using, but I personally think about 80% of heavy drug users look like everyday normal people. These people wouldn't turn my head at the store or out on the streets. These people have jobs, have families, have lives outside of drug use. A lot of them have emotional and mental challenges that surpass any physical sign of drug use.